This program is about emergency situations. After completing this lesson, you will be able to describe the priorities of care in responding to an emergency, define 3 signs or symptoms of a fracture, describe one method to control severe bleeding, and explain 2 steps in the treatment of a burn.
It is the beginning of another hectic day in the Stewart household, and, as usual, breakfast is a wild affair. Katie, a college freshman, overslept and has to eat on the run. Harry, although officially retired, will be off to the office after he retrieves his glasses from the upstairs bedroom. And Marie will have just one more cup of coffee as she checks the baseball scores. Just another day? Those terrible sounds, the ones that make your heart skip a beat and cause you to break out in a cold sweat. Something terrible has happened, and you must respond fast. In case of an emergency, what should you do? You are likely to encounter emergencies, not only as you care for those who are ill or incapacitated, but in your own home with family members, as you participate in sports and recreational activities, or as you move about in the community. Because you are in the health field, people will look to you for help. They will expect you to know what to do, to implement a plan, or to direct others to appropriate action until medical personnel take charge. Just what is an emergency? An emergency is an unplanned event, a situation that demands immediate attention. An emergency can be life-threatening, requiring instant action to save a life. Life-threatening emergencies include respiratory arrest, heart attack, choking, stroke, drowning, heavy bleeding, poisoning, shock, and major trauma. Suppose your patient fell and hit her head. She is not breathing. Time is critical and you must respond. At other times, the emergency will not be life-threatening, but you must provide prompt care and first aid in a less urgent manner. This time, your patient fell and broke her arm. She needs proper treatment to prevent further damage and complications. In any emergency situation, you must respond promptly and appropriately. In case of an emergency, you may be the one to take those first critical actions. There are other members of that response team: paramedics, emergency medical technicians, police, fire, and ambulance crews, hospitals, emergency rooms, and clinics with physicians, nurses, and other healthcare personnel. And there is your agency or institution, with the nursing staff and supervisory personnel, all there for you, ready with help and advice for any problem you may have, or any situation that comes up. It is essential that you understand your role and the role of the others in responding to an emergency. Be sure that you take the time to discuss with your supervisor any policies or procedures which affect your actions. Let's start with you. When you are the first person on the scene, your role is critical. The first care at the moment when the emergency occurs may mean the difference between life and death. This can be an awesome and sometimes scary responsibility. I want to assure you that feelings of great anxiety are not uncommon. Paramedics, who deal with crisis on a daily basis, will tell you that they sometimes have butterflies in their stomachs as they provide care. They are successful because they know what to do so well that their response is nearly automatic. They have been trained and educated. You may be a little shaky in the knees, but you can stay in control and handle any emergency capably and efficiently if you know what to do. These general guidelines will serve you in case of any emergency. Be prepared. The first step in that preparation is a good, basic knowledge of first aid in emergency response and care. Formal first aid and CPR training not only provide the necessary skills for handling an emergency situation, they also teach you how to assess emergencies to determine which require immediate action and which do not. If you have not received formal training in CPR and first aid, prepare yourself now by taking a course before you are confronted with an emergency on the job or in your personal life. In your basic training, you were probably taught emergency situations and procedures. You may have also received the formal training necessary to administer CPR, the Heimlich maneuver to aid a victim of choking, or other first aid. This program will not take the place of that formal training or reteach those skills. But we will discuss highlights of some of the situations you may face. This will serve as a way for you to review your skills and evaluate your knowledge. If at any time you feel you do not have the basic knowledge you need or are unsure about your abilities, ask your instructor for assistance. And do not be afraid to stop this tape at any time to ask for further help or explanation of procedures and policy. After you have received that basic knowledge, you must know which emergency medical services are available in your community and how to access them. If your community does not have the 911 emergency system, know the important numbers so you can call them directly. The telephone operator will get help to you, but it will take longer. Numbers for emergency assistance should be on or near the telephone. If they are not there, put them there so they are readily available. Your list of emergency numbers should include the local fire and police departments, paramedics and ambulance transport, poison control, the family physician, a person to contact in an emergency, and members of your support system, such as your nursing supervisor. In the lesson plan for this program, we have included a key you can complete with the emergency numbers that you need. When do you place that call for emergency assistance? As soon as possible after you have determined that help is needed. If you are alone and near a telephone, call at once. If there is someone else you can instruct to call, do so while you attend to the victim. In a remote location, you may need to give extensive first aid before you are able to get help. You have probably discussed in your training sessions that if you have to stay and keep the victim alive and cannot telephone for help, then stay and hope someone comes along to help. In any situation, if you have any doubts, call for help. If you are not sure whether the situation demands medical attention, err on the side of calling. When you do call for emergency assistance, this is the essential information you must provide. Precise address and specific directions if relevant. For example, upstairs flat or the backyard. The nature of the emergency. What happened, such as a fall, a heart attack, or a car crash? Who needs help? How many persons are involved? What is being done for the victims of the emergency? Who is calling and the phone number? Stay calm, speak slowly and clearly. Do not yell. Do not hang up until you have answered all questions you are asked and the other person hangs up. It is also important that you know when to contact your nursing supervisor and any family members. Your agency or institution has specific policies which will guide you. Take a minute now to discuss emergency notification of your supervisor and any family members. In an emergency situation, do what you can to stay calm and keep the victim calm. And do not harm the victim. In the stressful moments of life-threatening emergencies, make sure that your actions cause no further injury. After you understand the basics of personal preparation, we can look at an emergency situation you may encounter. Anne and her friend are visiting Anne's grandfather, Roger. He was recently discharged from the hospital after suffering chest pains. As Anne walks into the kitchen, she sees Roger on the floor. He is not moving. He is cut and bleeding. Thoughts flood her mind. What must she do first? Even though this is her grandfather, Anne goes into action. The American Red Cross teaches that you must always deal first with what is life-threatening. And there are guidelines which will help you organize and prioritize your actions. We are going to discuss a few of the keys to successful emergency care that will supplement your basic training, and then see how Anne implements the guidelines in the emergency she faces. First, you must rescue the victim from danger. If danger is imminent, you must remove the source of danger or remove the person to a safe area. A teenager mowing the lawn collapses from heat stroke. The lawnmower is still on. Turn off the mower to remove the source of danger. Never move a victim unless it is absolutely necessary. There has been a car crash and the car is on fire. You must remove the crash victim and yourself to a safe area. Now let's return to the emergency situation Anne faces. Her grandfather Roger is getting ready to carve a roast when he collapsed. Even though blood is flowing from a deep cut in Roger's arm, bleeding to death is not the most urgent threat. But the knife itself presents a real danger. The first thing Anne does is to remove the knife. After rescuing from danger, check for consciousness. If the person has lost consciousness, he may have also stopped breathing. To check for consciousness, tap the victim's shoulder or arm firmly. Ask very loudly, "Are you okay?" Someone who is conscious will respond and will not have stopped breathing. If there is no response, shake gently and shout again. Be careful because there could be a back or neck injury. If there is no response and the victim is unconscious, immediately call out for help. Anne checks for consciousness and immediately calls for help when Roger does not respond to her questions. Restore breathing and heartbeat if necessary. Here you would rely on your CPR training to guide you. CPR is an organized approach for assessing and dealing with a medical emergency. The purpose of CPR is to keep the person alive until the heart and lungs start to function on their own, or until medical help arrives. The American Heart Association has established a standard procedure to follow based on the ABCs. A is for airway, B is for breathing, and C is for circulation. This brief review is not meant to teach CPR. You must attend a formal program for that. A is for airway. Once you are sure that the victim is unconscious, position him on his back and open the airway. To open the airway, tilt the head back and lift the chin. Sometimes that is all it takes to get the person to begin to breathe. To check for breathing, listen, feel, and look. Put your ear down over the person's mouth. Listen for breath sounds. Feel for air on your cheek. Look at the chest to see if it is moving. B is for breathing. If the victim is not breathing, you would begin mouth-to-mouth breathing. Pinch the nose shut while maintaining the head tilt and make a seal with your mouth over the victim's mouth. Give 2 full breaths, watching to see the chest rise as you blow vital oxygen into the lungs. Listen and look for breathing. After you have given 2 breaths, check the carotid pulse. A person may stop breathing for a time while their heart continues to beat. But if their heart stops, breathing stops with it. If the person has a pulse but is still not breathing, continue the rescue breathing. C is for circulation. If the heart has stopped, chest compression or artificial circulation manually pumps the heart muscle to help it circulate blood. This is the only way that the oxygen you provide by breathing for the victim can get to the brain and other vital organs. Using the index and middle fingers, locate the notch where the bottom rims of the rib cage meet in the middle of the chest. Place the heel of one hand next to the fingers. Put your other hand on top of the first hand. You can interlock the fingers or keep them straight. Bring your shoulders directly over the victim's sternum and straighten your arms. Press straight down on your hands, compressing the chest 1/2 to 2 inches to squeeze the blood from the heart muscle. Continue at the rate of 80 to 100 compressions per minute. The rate depends on the circumstances. If you are doing CPR alone, you must also continue to breathe for the victim. In our emergency, Anne implements the ABCs of cardiopulmonary resuscitation. She opens Roger's airway, checks for breathing, and gives 2 breaths because he is not breathing. She checks the carotid pulse. She determines that Roger's heart is not beating and begins chest compressions while maintaining rescue breathing. After attending to the airway, breathing, and circulation, the next priority is to control heavy bleeding, also called hemorrhaging. Most bleeding caused by an injury is not life-threatening. However, because a person can bleed to death in a minute or 2, control of heavy bleeding can be a big priority, depending on the situation. Hemorrhaging can be external from obvious wounds or cuts, or hemorrhaging can be internal from a fracture or injury to organs. There may be no obvious signs of hemorrhaging, but the internal bleeding can be life-threatening. To better understand why some bleeding is more serious, it is helpful to know the three sources of bleeding and the treatment. Bleeding from capillaries, which are the tiniest blood vessels, oozes slowly and is usually controlled by the clotting action of blood itself. Venous blood is dark red and usually comes from deeper cuts. This type of bleeding is usually controlled by applying direct pressure to the wound. Arterial blood is bright red and spurts forth each time the heart muscle contracts as it beats. Bleeding from an artery is extremely serious. When you are faced with severe bleeding, implement actions to prevent shock, be alert for cardiac arrest, and take these key actions. Lay the person down. The head should be slightly lower than the rest of the body, if it is possible and safe to do. This channels blood to the brain and reduces the risk that the patient will faint and fall. If possible, expose the wound and elevate the bleeding part. This takes advantage of gravity to slow the blood flow. Apply your formal training here. You would not lower the victim's head if there were a head wound or elevate a fractured arm that is not splinted. Cover the wound with a sterile bandage, clean towel or cloth, or whatever is available, and apply continuous, direct, firm pressure until the bleeding stops. Remember, there is the potential for infection through an open wound, so use common sense to keep the area as free from contamination as possible. If nothing else is available, cover the wound directly with your hand. If bleeding does not stop with direct pressure, use your other hand to apply direct pressure to the major artery that supplies blood to the area of the wound. This diagram shows the pressure points that would assist in controlling bleeding. There are several pressure points where arteries can be felt and compressed against the bone to slow the flow of blood from the heart to the injured area. For example, if the wound is on the lower arm, you would apply pressure to the brachial artery, the main artery in the upper arm. Continue to apply pressure to the wound itself. Do not apply pressure to arteries leading to the head or neck, as this may interfere with circulation to the brain. When bleeding stops, secure the pressure dressing with tape or a strip of gauze or cloth. If blood seeps through, add more dressings, but do not remove the pressure dressing that is over the wound. Immobilize the injured area and seek medical attention at once. A tourniquet is a last resort. When the victim is in danger of bleeding to death, the risk of losing a limb is secondary to saving a life. It is not advisable except when a limb has been amputated and there is uncontrollable, life-threatening bleeding. Medical experts recommend that only an individual who has been trained in the application and use of the tourniquet should apply one. Anne turns her attention to the next priority on the list after Roger's heartbeat and breathing return. To control the bleeding, Anne grabs the dish towel and applies direct pressure to the wound. The next point on our emergency response list is to treat for poisoning. A poison is any substance which injures or destroys living tissue and can even cause death. Our environment is filled with potentially toxic substances, insecticides and pesticides, cleaning products and disinfectants, medicines, inhalants, plants, chemical pollutants, and others. Even substances that are harmless can be toxic if used in the wrong way or taken in the wrong amounts. Proper management of poisoning requires expert knowledge and guidance. The most important single resource in handling a poison emergency is the local Poison Control Center. The Poison Control Center can provide valuable information and training for proper emergency treatment. Keep the number of the Poison Control Center on or near the telephone, posted in a conspicuous place. In case of a poisoning, call the center at once. Identify yourself and give your name, location, and telephone number. Give the name of the substance ingested and, if possible, the amount. If the bottle or package is available, read the chemical description, including trade name and ingredients from the label. State who has been poisoned, age and weight, signs, symptoms and condition, such as level of consciousness, skin color, respirations, breathing difficulties, mental status, any convulsions or vomiting. In any emergency situation, it is imperative that you take measures to prevent and treat shock. Shock describes a slowing down or cessation of life-sustaining functions caused by an insufficient blood supply to vital organs. This is due to loss of blood, either internally or externally, following a severe injury. Know these signs and symptoms of shock: cool, clammy skin which is pale or gray in color, rapid, weak pulse, shallow, irregular breathing, staring eyes with dilated pupils, weakness, faint feeling, confusion, restlessness, loss of consciousness, anxiousness, or low or inaudible blood pressure. Even if an injury is not life-threatening, the person can die from shock. It is a medical emergency that demands immediate professional attention and treatment with oxygen and intravenous fluid replacement. First aid for shock should begin at once to improve blood circulation, safeguard the supply of oxygen, and maintain the body temperature. Call for help immediately. Keep movement, noise, and surrounding activity to an absolute minimum. The victim should be lying down with the head tilted to one side, unless you suspect injury to the cervical spine. Elevate the feet, unless breathing difficulties or pain result. You may need to modify the position depending on the circumstances. Do not raise the feet or lower the head if the victim has sustained a head, neck, back, or lower extremity injury. Loosen clothing, open collars and belts. Cover the victim with a blanket or whatever else is available to conserve body heat. Provide shade and circulation of air in warm weather. Do not give food, drink, or sedatives, even if the person requests it. You can moisten the victim's lips. Talk in a calm, reassuring voice. Stay with the victim until medical help arrives. We have discussed the ABCs of cardiopulmonary resuscitation and the treatment of poisoning, heavy bleeding, and shock. Only 2 steps remain on our list of emergency priorities. Examine the victim quickly and carefully to identify any other wounds or problems. A person with a fractured arm might also have a scraped knee that was ignored. If practical, tend to minor concerns and see that your patient is as comfortable as possible under the circumstances. Verbal reassurance is important during a crisis to allay fear and prevent panic. The last step is to get medical help. Throughout this discussion, we have indicated that it is essential to get medical assistance for your patient as soon as possible. If you were not able to obtain help until the patient's life-threatening situations were stabilized, you must now get the necessary assistance. Stay in charge until help arrives, and then provide an accurate account of what happened, including time of onset, signs and symptoms, duration, what you did, and the victim's response. Give information only to someone in authority who needs to know it. In case of an emergency, if it is possible to do so without interfering with your care, jot down information as you go along. Sometimes it is hard to remember details later due to the stress of the moment. Be sure to document all the important information and report to your nursing supervisor. And remember to observe the patient's rights to treatment with dignity, respect, and confidentiality. Anne walked into a real emergency situation, but she was prepared with the knowledge of CPR and first aid and properly administered care. Anne remained alert for signs and symptoms of shock. She stayed with her grandfather until help arrived. In the case of this life-threatening emergency, Anne responded appropriately and effectively and saved the life of her grandfather. Let's pause to review the vital information we have learned. What is CPR? What are the ABCs of cardiopulmonary resuscitation? Can you list the steps in organizing and prioritizing your response to an emergency? How would you treat hemorrhaging? What is the most important resource in handling a poisoning emergency? What is shock? How do you prevent shock? Now that we have covered the basics of dealing with emergencies, Let's go back and look more closely at the heart-pausing sounds that opened this program. For each incident, we will give you a chance to stop the tape so you can discuss how to respond to the emergency. That way, you can apply the keys of your knowledge or identify what type of help you may need. Remember the gentleman in our opening scene? That's Harry. Harry has arthritis, which is most troublesome in his right hip and knee. Today, Harry was in a hurry and had to go upstairs to get his glasses. When you hear the thud, you almost know immediately what has happened. Your fears are confirmed as you see Harry lying at the foot of the stairs. His face is ashen and twisted, and he is moaning with pain. His right leg is twisted at a tortured angle. He does not move. So many questions flood your mind as you assess the situation and prepare to render appropriate emergency care. How far did Harry fall? Did he bump his head? Did he fracture his hip? What would you do for Harry? Take a moment to discuss how you would respond in this situation. Were you able to develop a plan to help Harry? We will discuss that later after we review what you have learned about fractures. Each year, 1.3 million fractures occur. A fracture is a crack or break in the bone. Young bones are flexible and bend like a branch of green wood. In fact, breaks in young children are called green stick fractures. Older bones break more easily when stressed by a force greater than they can withstand. Fractures may result from a direct blow to the site or indirectly. For example, you can fall on your knee and fracture a hip. A fracture usually requires some movement. How do you know if a bone is broken? Look for these signs and symptoms. Pain that gets worse during movement or weight bearing. Swelling or bruising over a bone. Bent or deformed position of the affected limb. Loss of function in the area of the injury. A bone poking through the skin. Or history of a fall, bump, blow, or other trauma. Or sudden pain or discomfort during a bending or twisting movement. When you see these signs and symptoms, ask to find out exactly what happened. Harry is alert and can tell you. At other times, witnesses may provide important information. What do you do if you suspect a fracture? Your goal is to protect the victim from further damage and complications. Of course, you always remember your priority list of life-threatening factors and respond in the manner we have discussed. Treatment then will depend on the site, type, and severity of the fracture, along with other aspects of the injury. Use your knowledge and good judgment to assess the individual situation and provide care. Now here is the key to what to do in case of an emergency due to a fracture. Call for appropriate medical assistance, depending on the individual circumstances. If there is any question that a bone is broken, do not move or have the victim move body parts that may be injured, unless he is in immediate danger. Movement can cause further damage. Do not try to set, straighten, or push bones back into place. Immobilize the injured area. Pain from a fracture that is not immobilized can increase the incidence or severity of shock. It may be necessary to use a splint, which is a rigid object used to immobilize an area of suspected fracture. Splinting is another one of those techniques which you should learn in a first aid course. Here are some general principles of splinting to remember. Splint the extremity as it lies, in the position in which it is found, with as little movement of the bones as possible. Fashion a splint to fit the need from whatever materials are available, which will keep the area rigid and prevent movement. Rolled up magazines and newspapers work well. So does a piece of wood, plastic, metal, a pillow, or a rolled up towel. The splint should be longer than the bone, extending above and below the injury. Pad the splint with gauze or a soft cloth whenever possible for comfort and stability. Fasten the splint to the limb with strips of gauze, cloth, or other material, wrapping toward the body. Secure the splint firmly enough to prevent movement, but not tight enough to interfere with circulation. After immobilization, control bleeding if necessary. Place a sterile dressing over the wound. Do not try to remove any foreign object, such as glass or metal. And treat for shock as appropriate. Here you will use your good judgment to avoid further injury. For example, you would not move a fractured leg, but a victim positioned on his back would be able to elevate his good leg. If an arm or shoulder is injured, help the patient to lie down without moving the extremity. Cover the patient to maintain warmth and stay with the victim until proper medical care is available. Harry's family encouraged him to remain still, and they called 911. The paramedics treated and transported Harry to the local hospital. He underwent successful surgery to repair the broken hip and is now getting along fine with crutches. In Katie's rush to get out of the house, she dropped a glass. While picking up the pieces, she cut her hand. What treatment would you suggest for Katie's injury? We have already discussed the treatment of hemorrhaging. However, most of the bleeding episodes you will face in everyday life will not involve severe bleeding. Many times, the treatment will involve simply washing the area with mild soap and water and applying a sterile bandage. Sometimes, if the wound is large, deep, or jagged, bleeding may continue. In that case, apply a sterile bandage and direct pressure over the area to stop the bleeding. Remember to do what you can to avoid contamination of the wound. Always report an injury to your supervisor, who will advise if further treatment is necessary. Katie was lucky because no major blood vessels were severed. She cleansed her hand, covered the cut with a sterile dressing, and applied direct pressure with the other hand. She was able to stop the bleeding quickly and even got to school on time. As Katie took the exam, she monitored the injury to be sure the bleeding had stopped. One more sound to investigate, one more crisis to respond to before we can call it a day. Marie's scream of anguish as she spilled freshly brewed coffee on her chest was understandable. As painful as this burn is, it would be considered a minor burn. What is the appropriate treatment? Before discussing treatment, let's learn a bit more about burns. Burns can be caused by a variety of agents: fire, the sun, hot objects, liquids, steam, electricity, chemicals, and others. Burns can cause minor irritation or be life-threatening. Burns are classified by degrees, according to their depth and tissue damage. A first degree involves only the top layer of skin or epidermis and causes only redness. Sunburn is a first-degree burn. There are few, if any, blisters and swelling is minimal. First-degree burns can be quite painful. Second-degree burns involve the deeper layers of the skin and result in redness and blistering. Swelling and pain can be more intense. Large blisters or areas of skin may peel away, leaving small, raw areas that ooze clear fluid and could become infected. Third-degree burns are the most serious, destroying full layers of skin. The superficial skin and fat are burned. The deep structures, muscles, nerves, and vessels may be visible or damaged. The area is red and raw, or charred black, and may have ashy white patches. Pain is no indication of the degree of the burn, since third-degree burns usually destroy the nerve endings. The treatment of a burn depends on the type of burn. A single burn may involve all 3 degrees of tissue damage. Base decisions regarding your treatment and medical attention needed on the worst degree of burn. Report any burn to your supervisor as soon as possible. With those thoughts in mind, here are the keys to the treatment of a burn. The goals of treatment are to ease pain, reduce the risk of infection, and prevent shock. First aid for minor burns, which are first-degree burns, and second-degree burns that involve less than 2 to 3 inches of skin, begins with flushing the area with cool water to reduce pain and stop blistering. Either submerge the burned area in cool water or hold it under cool running water for 2 to 5 minutes. Pat dry with a clean towel. Cover the burn with a dry, sterile, or clean bandage to protect from contamination. Do not apply ointments, grease, or butter to a burn. If pain is intense, it may be necessary to seek medical attention. The larger the burn, the greater the need for emergency treatment. Major burns are second-degree burns, which cover large areas of skin or are on the face, hands, feet, groin, buttocks, or a major joint, and all third-degree burns. The first step in treatment involves removing the victim from the source of the burn if necessary. If the person's clothes are on fire, douse with water or smother the flames by rolling the person on the ground or in a blanket or coat. Do not try to remove burned clothing, but be sure there is no danger that the clothing is still smoldering. Call for emergency medical help immediately. An immediate complication of a major burn is shock due to massive loss of body fluid through the burned area. Treat for shock. Lay the person down and elevate the feet if possible. Do not cover the burned area with a blanket or heavy towel. Apply cool compresses briefly. Because the burned area is wide open to infection, cover the area with a dry, clean, or sterile bandage. If the area is large, use a clean bed sheet. Marie sustained a first-degree burn on her chest, which involved a small area and only the first layer of skin. Because of the burn's location, she could not submerge it in cool water, so she covered it with a cool, moist compress and then applied a sterile bandage. Now that we have discussed some of the emergencies you may encounter, let's review your knowledge. What are the signs and symptoms of a fracture? What would you do if you suspected that your patient had sustained a fracture? How would you treat bleeding from a minor cut? Can you describe the types of burns? How would you treat a minor burn? What would you do in the case of an emergency? We have discussed several keys of knowledge which will help prepare you for an emergency. Remember the priorities. Rescue from danger. Check for consciousness. Restore breathing and heartbeat if necessary. Control heavy bleeding. Treat for poisoning. Prevent or treat shock. Examine for other problems. Get medical help. Be sure that you are prepared for an emergency. Know CPR and first aid, as well as important policies and procedures which guide your actions in an emergency situation. And there is one more thing about emergencies which we can only briefly mention, and that is prevention. Spotting hazards and taking steps to prevent injury is just as important as treating the emergencies when they happen. Many emergencies could have been prevented, and that is a lesson which the Stewart family learned the hard way. Harry now wears his glasses at all times, as he should, enabling him to judge stair steps and avoid falls. Katie plans her day more carefully, so she has time to study and does not oversleep. She even has time now for a nutritious breakfast with her family. And Marie still enjoys her cup of coffee, but she is more careful that she does not become so wrapped up in the newspaper that she is distracted. Having gained a greater appreciation of the value of emergency care, the Stewarts have taken first aid and CPR classes. They are taking the necessary precautions to prevent emergencies, but they are also prepared in the event one occurs. In case of an emergency, you too must be prepared. You can be the key to proper emergency care and treatment. For someone, you may well be the key to the door of life.